This is the chapter on sleep and its effect on performance, featuring Dr. Chris Winter, Medical Director at the Martha Jefferson Hospital Sleep Medicine Center.
Let's now talk about sleep and how it affects players at the 8 and under level, and how your understanding of sleep can make you a more effective and complete coach. Healthy sleep habits and a basic understanding of sleep fundamentals should begin at this age. Proper sleep in children can have significant effects on a child's development, behavior, and physical and mental health. Within this age group, there is often more concern about player sleep from the child's parents than from the child, him or herself. Parents are often concerned that their child may not be getting the right amount of sleep. The wide range of sleep need duration seen in younger children by this age group has begun to narrow and usually consists of 9 to 12 hours of sleep per night. Most children in this age group have given up daytime napping by the age of 4 or 5. The time between the toddler years and the onset of puberty is typically a time of maximal daytime wakefulness for most children. Children who seem to still require naps during the day are rare. This behavior may indicate either inadequate sleep amounts at night or dysfunctional sleep. Limit-setting issues in the home, such as a child being allowed to stay up late, or difficult family dynamics, like a parent who works late or one who leaves for work early, may come into play. Children within this age should have ample time in which to sleep, as it is uncommon for this age group to have significant conflicts between sleep time and homework or extracurricular time. This said, it is important for coaches to be vigilant for signs of excessive sleepiness in their players. The signs of sleepiness in young children can include obvious behaviors such as excessive napping or unusually long sleep periods. Signs can also include hyperactivity, mood deterioration, impulsivity, such as a child acting out without proper consideration of the consequences of one's actions, and poor concentration, all of which may affect a young athlete's ability to learn and to potentially be safe. Studies have shown that children who have regular bedtimes and adequate sleep score higher on a range of developmental assessments. Inquiring about factors that could be compromising player sleep quantity or quality can be a positive first step in helping players feel their best. Sleep is composed of 3 distinct stages: light sleep, deep sleep, and REM sleep. These stages are important for various reasons. Light sleep composes the majority of sleep in youth. Deep sleep is most important for helping children feel rested and is the sleep of physical recovery. REM sleep is dream sleep. In young children, growth hormone is secreted during REM sleep, so REM sleep disruptions can impact a child's physical growth. Sleep apnea and breathing disturbances are among the most common disruptors of sleep quality. Sleep apnea is a condition in which the child's airway collapses or becomes obstructed during the night, resulting in disturbed breathing and interrupted sleep. Large tonsils obstructing the airway are often the cause. However, other anatomical causes can be seen. As in adults, significant obesity can be to blame in some cases. When sleep becomes interrupted, the flow of sleep from one stage to another is affected, and negative consequences can occur. For this reason, the American Academy of Pediatrics recommends that all children be screened for snoring. Children who snore should be referred for a more detailed evaluation, as snoring can be a clue as to the presence of sleep apnea. Sleep apnea in children can have numerous health and developmental consequences. Attention problems, mood disturbances, and even growth consequences can arise from undiagnosed sleep apnea. Unlike adult sleep apnea, where sleepiness is often very significant, the sleepiness associated with the condition in children is often subtle. The assessment of whether or not a child snores can easily be included in the screening process of most leagues. I hope this information I've presented to you about sleep is useful in your coaching of your players. Making observations during practice of a player who's done very well and adding the comment, "You did a good job today. Have you been getting good sleep?" or talking to a parent after a difficult practice and asking if that player is beginning the sleep he needs are very easy ways that you can make observations and comments that let both your players and your parents know that you think about sleep and you value its importance in their development as hockey players.
That completes the video portion of this segment. Now let's move on to either your test or additional resources to reinforce and support what we've been talking about.